Today, Pfizer is committing to offer all of their prescription medications to Medicaid, and it will be at the most favored nation's prices. It's going to have a huge impact on bringing Medicaid costs down like nothing else. I told you that in my first term, I was so proud of the fact that for the first time in 28 years, drug prices came down. And I had a news conference that I explained it was 0.1%, but it was down. And here we're talking about, in one case, over 1,000%. This is a critical step forward to our work and to improve health care and hardworking, low-income Americans.
So earlier this week, Donald Trump made that statement, and some people are saying, is this socialized health care? It's not the way I read it, and I want to talk to Dr. Oz about that, but I also want to talk to him about the shutdown because people don't really understand why the government is shut down, and it all centers around Medicare and paying for illegals who should not be here in the first place. There's a lot to this. Dr. Oz is with us now. Hi, Doctor. How are you?
Hey, Glenn. Let's tackle that second issue first because it is much on mine. So I'm here in the Capitol. I'm literally looking at the Capitol building right now, and senators are in there trying to figure out what to do. But it is really reprehensible what the Democrats are doing. This has been a process, this continuing resolution process, whether you like it or not, that's gone on for a long time. It happened in March. There's nothing to discuss here. We have a lot of things we can fix in America. One of the things we addressed, I think, quite successfully is the fraud, waste, and abuse in Medicaid. In fact, some of the points you make, like money going towards illegal immigrants, that, again, it's not that you're paying for it in California. It's that folks are being taxed in Mississippi and Texas and Florida, and that money is being shipped to California. We stopped that. We're not going to reverse that, and we're certainly not going to reverse it for 7 weeks of continuation so we can actually have more negotiations. And there's a lot of other things that play in here, but I'm the one who's supposed to be taking care of Medicare, Medicaid, the exchanges. These programs can get hurt if you shut down the government. We've got to make sure we have telehealth that works. We've got to make sure there's you can be hospitalized at home if you're really sick as opposed to in the hospital, which is very effective in many situations. These programs we struggle to keep open when you have a shutdown of this nature. This is high stakes poker and it's unfair. And frankly, the Democrats don't have many chits anyway. So I think they ought to get past this, swallow their pride. This was a mistake, and let's go forward and fix some of the other issues that might be worth discussing.
So I saw a doctor write an op-ed and he said, look, I'm working the emergency room and somebody comes in and they've got a gunshot. And what am I supposed to do? Ask if they're here legally? No, that's not what we're talking about, is it?
No, not at all. If you go to the emergency room, then we have a law in TALA that will protect you. You will get the care you need, especially if it's life-saving care. You're in trouble if you don't provide that care. So this is not about that at all. This is about giving benefits to illegal immigrants. Again, I'll pick on California because it's such an obvious case. Tens of millions of dollars of vision, dental. I mean, if you're on Medicare, you don't get dental. If you're on Medicaid in California and you're an illegal immigrant, you are getting free dental care. I mean, it's just not fair to the American people. Again, it's not like the citizens of California are paying for that. We're footing most of the bill at the federal government, which is we tax every one of the other 49 states. And then we pay California to make up for the fact that they've decided to fund illegal immigrant health care. And guess what happened, Glenn? When we put our foot down and said, we're done, we're not going to do this anymore. After all the whining and complaining about how bad and reprehensible Republicans are in Washington, guess what Gavin Newsom did? He shut down exactly the programs we'd said that needed to be shut down. He wasn't going to pay for it either. They're fine being nice about these things and, above reproach when it's not their money. But if you're spending your own money, all of a sudden they start to act like Republicans.
And this is something that was in the big, beautiful bill. This is something that was passed by Congress to stop this. This isn't new. That we already discussed it. It already passed. It's a law. And now in this negotiation period, they want to say, oh, you've got to repeal that part of the law. Correct?
Correct, Glenn. And but the part that I don't think the Democratic leadership understands is we saved Medicaid. I'm sitting here in the Hubert Humphrey building, and there's a great quote he has in the opening, the archway. It says, it's the moral responsibility of government to take care of those who are at the dawn of life, the children. 53% of kids are born into Medicaid or CHIP. Those in the twilight of life, the elderly, those are folks who are older and don't have resources. They're really in trouble if we don't help them. And then those who are living in the shadows. And Glenn, that haunting metaphor of light, I think about every day. That's who Medicaid was designed for. I am not going to let the program implode under the weight of able-bodied individuals who were never designed to be on Medicaid.
Right.
So we fixed that. We also fixed the money laundering, the legal, but still money laundering in terms of its effect that states were doing to take advantage of the federal government. Now everyone can chip in fairly as the system was originally designed.
Can you go into that? Because I saw a press conference, I think it was last week. I think I was in Phoenix last week, and I saw a press conference where the FBI had done the biggest sting operation in Medicare history, and it was stunning how much money was being stolen, even by foreign governments that were being involved. Do you have any of that you could recall?
Well, we were, I actually was at the press conference. It was me, the Office of Inspector General, this FBI, and the Department of Justice, and we busted a $15 billion multinational criminal syndicate. I'll share with you that it's primarily Russia-based. The perpetrators fled to Russia, which is why we think that's the case. Now, my job is to make sure the money never leaves the building. So although it's a $15 billion effort, they only stole $2.9 billion. Think about that. Only $2.9 billion. It's a lot of money. But they didn't get all 15 billion. But we have a massive target on our side. My agency, CMS, distributes about $1.7 trillion to the American people for Medicare and Medicaid. Again, our most vulnerable depend on this program. Foreign governments can take a beneficiary number of a Medicaid or Medicare patient and pierce us and start stealing and sucking like ticks money out of the system. So we need to stop that. And I've spoken to Attorney General Bondi. Actually, Treasury's helping us, Scott Bessent, because there's banking reform we need, because these folks are also laundering money. But Glenn, they're taking tens of billions of dollars away from American taxpayers. We have not realized how massive this criminal conspiracy is. And these are not small-time players. These are big multinational efforts.
It was one of the most stunning press conferences I had ever heard. I listened to it. And I was in the car by myself, and I'm like, oh my gosh, oh my gosh. It was stunning. And it ended with, and this is just the beginning. Is there much more of this?
This is the tip of the iceberg, Glenn. It would get you and the listeners, viewers so angry if they understood the scale of this problem. We have more durable medical equipment suppliers, knee braces, back braces, wheelchairs. We have more of those folks in South Florida than McDonald's, I am told. And we think the Cuban government's helping them. We know the Chinese are involved. There's in hospice fraud in California. We have many, many programs that can boast survival rates of 5 years or longer for their average customer. You're in hospice. By definition, you're supposed to be living your last few weeks to months of life, and yet everyone seems to live 5 years in these programs. Why? Because they're not really terminal. These folks are being they're being lied to or they're being pulled into the system. And these are the kinds of endeavors we are aggressively pursuing. We have a whole fraud, waste, and abuse war room. The president passionately wants us to break down the silos. So we're working with Treasury and DOJ, FBI, all of us collaborating together in order to shut this down. These are bad people, and they will cheat us at every level. But again, they are being supported by foreign governments.
Last question on this, because we go back to the shutdown. I've always looked at borders and everything else as the Titanic. The Titanic is going down. The reason they didn't turn the lifeboats back to get everybody else, even though some of them were half empty, is because they were surrounded by people and they all would have died. And you can't swamp the boat. And every time I see, people trying to put more and more people on that are not citizens here, you cannot do it, or we won't be able to help anyone. It will just collapse.
Then the hard part of this discussion that we're having is why doesn't it become obvious to everybody that what you're saying is true? And let me give you a good example because it came up this week at the White House. The president, since day one, has been calling me about most favored nation drug pricing. Now, the president's very thoughtful about the issues he focuses on, and this is clearly one that he has said is a defining element of his presidency. In fact, he had me on speed dial. We were joking about this at the press conference because he and Bobby and I were both getting called continually because he cares so much about this. Why? Because it's global freeloading. What you're witnessing happening, and it's gone on for decades, is other countries, European countries, affluent nations, are able to get their drug prices made in the same factory, the same boxes, the same ingredients for 1/3 or lower the price that the American taxpayers having to pick them up for. And so we've got a lot of Americans, probably 1 in 3 go to the drugstore. They can't afford their medications. In fact, they have to choose between groceries and pills for their health. That's not the right thing to happen, especially when we're being taken advantage of. We're 4% of the world population. We fund most of the world's research. We generate probably 3/4 of all pharma profits in this country. And the president said, enough is enough. Just like NATO, metaphorically, was an effort that we all got together and said, you know what, you guys got to ante up if you're Europeans to protect yourself from external threats. We have internal threats as well. And the Europeans have been able to shunt the expense to us. They create these fictitious systems that argue that a human life's worth $25,000, so they won't pay for drugs that, for example, cure cancer. If you have cancer in Europe, if you have money, you come to America, because the chance of surviving here is 30% higher than if you have the same problem in Europe, because we actually have innovation. We have cutting edge tools. We have solutions that we have invested in, and we are not going to compromise that. But the president said, I can have innovation and I can have fair pricing as well if I push the Europeans and protect actually our homegrown innovation, so it's not defrauded by European sovereign nations. So if the United States sticks up and says, we're not going to let you get drugs for 1/3 or less the price that we're paying in America, you guys pay more so we can pay less, it's got to be most favored nation pricing. Everyone pays the same amount. We're all in this together. We got to fight internal threats like cancer and autoimmune problems, heart disease, just so we got to fight external threats. And this global freeloading that has taken advantage of the American people for so long, it's ending. So on Tuesday, as you saw, the president, in that little clip you showed earlier, went full force to emphasize that the leading company in this space in America, which is Pfizer, has agreed to most favored nation pricing, which means all Medicaid patients get best price in the world. So governors now can afford their Medicaid programs more. That's the program, by the way, that the Democrats are complaining about for the shutdown. We're actually not just reallocating the deck chairs to the Titanic using your same metaphor. We're actually, solving the problem by reducing the actual cost of drugs. We're going to make sure every new drug brought to America has to be priced at the best available number around the world. We're going to make sure that we have additional benefits with some really popular drugs being sold at lower prices. And TrumpRx, I'm going to announce, make sure everyone knows what that is. It's an opportunity for you to get the best prices for the drugs that you're on anywhere in the world. And we'll send you to the right place to buy them. We don't want to get involved in capping prices. This is a free markets model. We want everyone out there making money, because people who make money innovate and they invest. We want all that. We just want fairness.
And it's not the government selling it. It's not the government buying it. It's the government directing to the cheapest drugs.
And we're cleaning up the middlemen. So if you go to our TrumpRx starting next year, we're going to say, okay, you're on this medication that's really important for your heart. Here are the 5 places. Here's your local pharmacy. Here's another option you can go to. Here's a coupon you can take back to your employer. These are the best prices for you. You pick what you want. We're not making money on it. This is a government site. We're just being an intermediary, creating a marketplace. But by doing that and bringing transparency to the process, again, if you're at a dinner table and you don't understand what's going on, you're pretty much you're on the menu. Right. So the American taxpayer is kept in the dark. I'm from Kennett Square, Pennsylvania, and it's the mushroom capital of the world. In Kennett Square, we always say that they keep you in the dark and they feed you manure. Right. And it's great for growing mushrooms, but it's not good for the American people.
So let me ask you one last question, and it's kind of an unfair question, I guess, but I think it's a way a lot of Americans feel, especially conservatives. Why Pfizer, for the love of Pete? Why did you have to start with Pfizer? Pfizer just has that bad COVID ring to it. Are they the only ones that are going to do it?
Oh, not at all. In fact, we have another company next week, but one the week after, another one the week after. We have them all coming in. Pfizer is a bellwether. A lot of the other pharmaceutical companies look to it for guidance and leadership. Its CEO, Borlia, which that's his image right there, is a leader in the industry. And so when Pfizer was willing to come into the Oval Office and bend the knee and tell the president they understand why he feels so strongly about MFN, and they get the joke and they understand that they need to change their practices. And if we're willing to do what's required to make global pricing fair, it's going to work. Then it sends a signal to every other pharmaceutical industry player that this is the way it's going to have to be. And you know what? It's working. They're all coming in. They were coming in anyway, but now they're rushing in to get involved in the president's program. Our goal is to get every drug possible. We want 95% of all drugs sold in America to be at most favored nation pricing by the time the president has done this wonderful 4 years.
I know we're out of time. Let me just ask one last question, and that is, a lot of our problems with healthcare caused by the insurance companies and this game of no, you can't cross state lines and all this stuff. Are you guys looking at that kind of stuff that could really shake up the freedom of medical care here in America?
Glenn, I love you. That's the perfect question. And we have this $50 billion investment in rural healthcare in America. It's, by the way, that's a 50% increase in the money that rural America gets from Medicaid right now that the Democrats want to kill in this effort to destroy the continuing resolution and keep the government open. But that $50 billion is designed to do just what you said. The Congress and president gave it to us to give it to the governors, and the governors are going to go in there to the insurance commissioner and say, no more games, guys. Everyone gets licensed if they want to practice in my state, or insurance commissioner. God. From now on, we don't want this gaming around prior authorization, which is a heinous process that so many Americans detest. All these other issues, we're going to deal with those to deliver better quality care. It's transformative. We're going to start in rural America, but those lessons are going to be spread to the rest of the country. We've got a big event.
When does that happen? When does that happen?
That money will be given out by the end of this year. So in less than 3 months, all the $50 billion given out over 5 years will be distributed, and the governor's going to be held accountable. If they don't do the things that we're talking about now, we can claw the money back. So guess what? I'm pretty sure it's going to happen.
I got to tell you, when you are ready to talk about that, please come back. My audience will love that message. Thank you. God bless, Dr. Oz.
Take care, Glenn.